Today, I'll be discussing cerebellar hypoplasia in cats, commonly called CH or wobbly cat syndrome. In this presentation, I will be exploring the neural anatomy of the feline, particularly the cerebellum and its function, the etiology and development of CH, its clinical signs and symptoms, how it's diagnosed in felines, how affected cats differ from unaffected cats, and finally, management and prognosis. To begin to understand cerebellar hypoplasia, learning where the cerebellum is and what its role as a part of the brain is key. The cerebellum is a part of the central nervous system, along with the cerebrum and brainstem. It's located at the back and bottom of the brain, where the spinal cord connects. The picture to the right showcases the structure of a normal brain. The cerebellum sits right under the main brain. Now we can comprehend the role that the cerebellum has for the body. The cerebellum controls motor and coordination by working on fine-tuned muscle movements. This connects with motor learning, which is how we as humans can figure out how to ride a bike or learn an instrument. It helps maintain posture and balance by adjusting to shifts in the body and telling the body to shift as well. The cerebellum coordinates eye movements and visual processing by controlling reflexes and coordinating eye movements with the head and body's movements. This allows us to track objects and keep our focus. Finally, the cerebellum, specifically in cats, can be linked to their stalk and pounce processor, movements that are considered natural cat behavior. In CH, the cerebellum is smaller than normal in cats because it fails to develop properly during gestation. This condition is not genetic, it is developmental. Damage-induced hypoplasia can also occur if the mother experiences severe malnutrition, trauma, or infection while pregnant. In this picture provided, we see three different felines with a normal cerebellum, a mild case of cerebellar hypoplasia, and a severe case of cerebellar hypoplasia. Each cerebellum is highlighted pink so that we can see the vast differences between the sizes based on how much their development was affected during gestation. The cause of cerebellar hypoplasia is a common question for those who see a cat that is moderately to severely affected by it. CH is not a genetic condition. Its most common cause is infection with the feline panleukopenia virus during pregnancy. FPV works quickly and is known for its swift attack on rapidly dividing cells, including the ones forming in kittens' brains. Inflammatory conditions can cause CH because they can interfere with cell proliferation, which is cell growth, or the formation of the neural circuit, which is how neurons connect to each other to create networks in the brain. The pictures provided below show the signs of FPV and how it is able to spread to cats. The best way to prevent FVP is by being aware of potential situations that could cause it and vaccinating the mothers. The observable features of CH in cats affected can be difficult to determine before a kitten or kittens are old enough to stand and walk on their own. This is because CH is primarily determined by how a cat's movements are affected when they walk, jump, or do any sort of movements. There is also a range for cerebellar hypoplasia, which can be from mildly affecting to severely affected, depending on how much of the cerebellum was affected. Typical symptoms include jerky or uncoordinated walking, swaying from side to side, hypermetria, which is also known as goose-stepping gait, and is described as high-stepping movements. Mild head tremors and intention tremors that worsen during focused movements are also typical symptoms. While I just discussed the observable features of CH in cats, this slide is to explain the layers of how cerebellar hypoplasia can affect cats. This picture of a domestic shorthair with a tabby coat pattern shows no visible signs of cerebellar hypoplasia. This goes to show that the condition cannot be diagnosed or suspected purely from looks alone. Now, if we dig deeper to the musculature of the cat's head, we can see several muscles that are consequently affected by cerebellar hypoplasia. While these muscles are not affected by CH structurally, their functions can be altered due to this condition. The masseter muscle is located laterally on the feline's head, lying slightly below the base of the ear as it is labeled on the diagram. The digastric muscle, the mylohyoid muscle, and the sternohyoid muscle are all located on the ventral part of the head, under the jaw. All of these are involved in jaw movement, chewing, and swallowing, so this could cause awkward or exaggerated movements when consuming food or water due to tremors or problems with motor control. The sternomastoid, located in the upper neck, and the clavotrapezius, located in the lower neck, help with head and neck movement, and when affected by CH, can cause head bobbing or tremors from the muscles being overreactive or poorly controlled. Finally, we get to the final layer, the anatomical structure of a feline. As we have discussed, cerebellar hypoplasia affects the cerebellum due to feline panleukopenia virus, causing it to be underdeveloped. The cerebellum is the most important component of CH, as it is the main effector. Other structures shown in this picture are similar to the musculature. They're not directly affected by CH, but they can be indirectly affected. This means that they present functional challenges, not structural abnormalities. For example, you may see uncoordinated grooming or drinking in felines with CH due to poor motor control, causing them to struggle with precise movements with their tongue. CH may present with difficulty swallowing or even gagging and coughing due to delays with the pharynx, soft palate, trachea, or esophagus. Next, we can move on to how cerebellar hypoplasia is diagnosed in cats and kittens. Diagnosis is unique for this disease because there isn't lab work or blood tests that can confirm if a feline has CH. However, blood work is typically done to ensure that there aren't other diseases at play. Instead, a veterinarian will perform a physical exam and watch movements to determine if there is an unusual, uncoordinated, or delayed gait in movements. An MRI or brain scan can show if the cerebellum is small, which can lead to the diagnosis for CH that can range between mild, moderate, and severe. Mild CH cats have slight incoordination and deal with mild clumsiness. Moderate CH cats have definitive wobbling and have struggles with jumping or running. They're able to walk but usually have a wider stance or tremors. Severe CH cats have extreme difficulty with most movements and require assistance with eating, walking, and using their litter box. On this slide, I will be contrasting the difference between cats who have cerebellar hypoplasia and cats who are not affected by this disease. With movement and coordination, cats affected by CH are characterized as having an unsteady gait, wide-legged stance, and are seen stumbling or swaying. Cats unaffected have a smooth and steady gait, and their movements are well coordinated. Cats affected have poor balance and may fall over with movement, while non-affected cats have good balance and are able to execute their movements precisely and accurately. Motor skills are affected by CH by causing cats to struggle with basic actions such as jumping, running, climbing, and walking. Non-affected cats do not struggle with these. CH has been seen to cause tremors in affected cats, usually seen with head tremors or nodding when they attempt to focus on a specific movement. Finally, learning expectancy does not progress as normally for cats with CH as with normal cats. As cats develop and grow, they learn based on instinct, but cats affected by CH usually have a learning curve for their bodies. They may have a wide stance or stumble that they have to learn to overcome in order to execute basic movement. After seeing 2 videos of cats with CH, we can see how it looks in a normal life. Now we can discuss the prognosis of this disease. There is no cure for cerebellar hypoplasia because it is caused by incomplete brain development. However, most cats with CH live a normal lifespan of 13 to 17 years. While cats range from mild to severe, many cats learn to overcome any issues with motor control as they get older and learn how to do things on their own. Prevention is the key with female cats that aren't spayed. If there is a chance of them reproducing or being bred, then their vaccinations need to be up to date to stop a virus that could affect the kittens' brains. Management focuses on safety, comfort, and independence. Environmental accommodations are important to ensure easy access and aid in helping with normal behaviors. A low-entry litter box and raised food and water bowls can help with reducing head tremors and avoiding difficulty getting to the restroom, thus avoiding accidents. Preventing injury is also important for CH cats, as their incoordination can create a lot of potentially dangerous situations. Non-slip surfaces like rugs or yoga mats can help with stability, as well as padded areas where they could potentially stumble or fall. Low-to-the-ground furniture and avoiding high speed or aggressive play can also be very useful. Some cats, mostly severe CH cats, can benefit from wheelchairs. They provide assistance and stability with moving around and can boost a cat's confidence so that they exercise and have a better quality of life. To recap this presentation, CH, or cerebellar hypoplasia, occurs when the cerebellum is smaller than normal, and since the cerebellum is responsible for motor movements and coordination, causes cats to struggle with everyday movements and actions. CH can be noted by a cat's movements, where they can appear to be clumsy, stumbling, or struggle with basic movements. It cannot be diagnosed from physical examination alone, and an X-ray must be done to see cerebellum size. Supporting cats with CH is dependent on where they fall on the range from mild to moderate to severe, where individual cats have different presenting symptoms. Adjustments may be made to litter boxes, feed and water bowls, play areas, and even accommodations like wheelchairs to give more freedom to move and run. This condition is not contagious to other cats, nor is it painful on its own. Cats may struggle with concurrent diseases or conditions that affect their well-being, but cerebellar hypoplasia on its own requires patience, understanding, and adjustments.